think it's important to recognize that we are meeting one day before the 60-year anniversary of Medicaid. And that is particularly important, I think, that we just take a minute and reflect on the promise of Medicaid and what it has meant and where we are today. 60 years ago, our country made a promise that if you got sick and needed health care coverage, that you shouldn't be left to fend for yourself. It's a pretty basic promise. And for 60 years, it has given life-saving access to health care services for millions and millions of Americans. People with limited resources, children, seniors, and those with disabilities. It gives kids a healthy start, and it lets seniors age with dignity. But today, that promise is at risk, as it has not been in a very long time. And I will tell you, in listening to our local healthcare providers, this is a looming five-alarm fire. It really is. That's the only way I could characterize it. Just a few weeks ago, there was a Republican budget, and it made the largest and most drastic cuts to Medicaid and health care in many decades. In fact, by some estimates, in the history of the United States, our modern healthcare system, the promise of which was strengthened with the Affordable Care Act just about 15 years ago. And with these cuts to not only to Medicaid, here in California known as Medi-Cal, but to the Affordable Care Act, which we call Covered California, the cuts are roughly 15 to 17 million Americans who are going to be losing their health care. And that's about 10 million who are going to be losing their access to Medicaid, and roughly 5 million more who are going to be losing their access through the Affordable Care Act. But what I want you to know is it doesn't just impact the people who are on Medi-Cal. It doesn't just impact the people who are on the Affordable Care Act. What has happened with this budget affects us all. It's going to mean that your hospital care will become worse. Your wait times will increase, the services offered will decrease. It means that your doctors who are already stressed out a lot of the time, thank you to our doctors, they're going to be under more stress. Our nurses, all of our care providers, really the only winner in all of this are the beneficiaries of the tax cut. And as you can see, you don't have to take my word for it, go see for yourself. Disproportionately, the people who will benefit from that tax cut are those at the very top. So what this is at the end of the day is a giant transfer of wealth from those who need the help, from the most vulnerable in our society, the vulnerable child, the vulnerable senior, the vulnerable veteran. And what it also means is that those folks are still going to get emergency care, but they're going to show up, we were talking to the doctors before, they're going to show up at the ER sicker with more acute care needs. That's going to be more expensive for everybody. We're all going to have to bear the cost of that. And the other thing I'll mention to you is the Affordable Care Act premiums. People are going to start receiving their notices in the mail this September, just in a matter of a couple of months, that their health care premiums under Covered California are going to go up. By some estimates, I've seen 50%, I've seen 60%. And it's not just people who are receiving the tax credits, the beneficiaries of the premium tax credits who are going to see their Covered California bills go up. It is anyone on Covered California whose health insurance premiums will go up. And indirectly, what that will mean over time is that everyone, whether you're on an employer-provided health insurance plan or you're on a private health insurance plan that you pay for yourself, everyone's premiums will go up. It is only a matter of time, and the first instance, the first real evidence of this that we will see will come later in September. So the estimates are that here in California, more than 2 million American citizens are going to lose their health care. 2 million just in California because of higher costs and stricter rules. That's another thing. Let's talk about these rules. The Kaiser Family Foundation did a study that 92% of people who are going to be thrown off health care are people who are eligible for that care, people who are working, people who meet the requirements, but do not fill out do not complete all the red tape, the bureaucratic red tape. That's what this is about. It is about bureaucratic red tape. Hospitals and nursing homes, in some cases, will be forced to shut down. Now, I hope that doesn't happen in our community. We're going to do everything we can to try to work with our local care providers to prevent that from happening, but it will happen across the United States. Families will be pushed ever deeper into medical debt, and very sadly, there will be people who die as a result of these changes that otherwise would not have died. Again, all of this just so those at the very top disproportionately can get another tax cut. So by the end of 2026 is when all of these requirements will hit. Some of the tax provisions for hospitals that are going to hurt our hospitals will happen over the course of the coming years. Just know this is all about regular, average folks losing their health insurance, not being able to go see a doctor, not being able to get the preventative care that they need. It's about kids, it's about seniors, it's about families, it's about veterans. And if you don't think that it's going to impact you because you're not on Medi-Cal, or you don't think it's going to impact you because you're not on Covered California, you're wrong. This impacts everyone, and it's only a matter of time before everybody realizes that.